Good afternoon, everyone. We are thrilled to see so many folks from across the country joining us for our conversation today. My name is Justin Jones, and I lead our family engagement initiatives at Flamboyant Foundation. So we're going to start by talking a little bit about our work and then really dig into the specifics and the details for all of you. So for those of you who are new to our work, Flamboyant Foundation is an organization co-headquartered in DC and Puerto Rico. For more than a decade, we've worked to ensure students have high-quality educational experiences. Our work based in DC is schools and systems to provide family engagement experiences that are meaningful, that are context-specific, and that accelerate student success. And a key pillar of how we work, no matter what the initiative is listening to and learning from the communities that we intend to serve. So it's with that in mind that we've pulled this particular convening together, and we're so excited to have you all here. Many organizations right now are making efforts to listen to families. In fact, more than half of you here today in the poll that we sent out before the meeting itself name having done so, and that's truly incredible. And listening ensures that the work that we do is relevant, that it's impactful, and it ensures that when we're working on solutions, family voice is at the center, which is truly important to all of us. We at Flamboyant have learned a lot over these last few weeks, and what we've also heard is that folks want more opportunities to access the listening and learning that others have done. So that's why we're here, and to provide a space for that hearing and learning and sharing as a starting point for all of us. So as you'll see, as we get further into the conversation, our guests today are based here in DC, but our hope is that no matter where you live, and no matter where you're joining us from, and I see in the chat folks from all across the country, that you'll leave with more knowledge and more ideas in your own tool belt as you do your own work. So with that, let's get this listening party started. In addition to listening to our speakers, there's a few things that we want to make sure that you know about and ways to engage in our conversation today. So the first is be active. Engage in a conversation with us and with your fellow attendees in the chat box, as many of you all have already started to do. We have two Flamboyant staff members, Justin Stevens and Camille Seward, who are here, and they're excited to connect with you throughout the event through that chat box. And as you all are chatting, links to work that you're doing, things that you want people to share with others are definitely encouraged as well. The second is ask questions. So there's also a Q&A feature, and that's for submitting questions specifically to the panelists. So we may answer those questions in writing, or we might use your question for the Q&A portion, which is going to come up in the second half of our webinar. So I encourage you to use that Q&A feature in addition to using the chat feature to chat with your fellow attendees. And the third is respond to the prompts. So between speakers, we're going to be initiating some quick pop-up polls or asking you to respond to the chat to get even more insight from you. So be sure to participate when those polls pop up. You'll see them pop up on your screen. It's very easy to just click your answers, and then we'll get those responses in real time and be able to share them back with you. So let's go ahead and get started with our first guest. And I'm thrilled to have her here with us today, Andrea Henson. Andrea is an active parent advocate in DC. She's one of our Flamboyant parent trainers. And through that work, she trains hundreds of educators each year on family engagement. So welcome, Andrea.
Hi.
It's great to have you here. Thanks so much for joining.
Thank you for inviting me.
Yeah, you bet. So would love to just start out by having you introduce yourself. Tell us a little bit about yourself, Andrea.
Okay, my name is Andrea Henson. Born and raised in Washington, D.C., went to D.C. public schools, graduated from Wilson. I have 4 children, 2 boys and 2 girls. One attends school she's in middle school, Lowell High School, or high school, Lowell, and I have 3 that attend DC public schools and DC charter school.
Awesome.
And I work for Flamboyant. I'm a parent trainer. I've been working with them for like 4 years now.
And you're an awesome parent trainer too. We're excited to have you here to share your experiences with everyone here today. So first question, just, as we check in, this is obviously a challenging time for everyone. How are you doing? Like, how are you personally doing?
I'm doing good. I'm trying to keep hope alive that we won't be in this thing forever. It's just temporarily for right now.
Yeah. Yep. And how's your family? 4 kids, right? Like full house. How's everybody doing? How's everybody feeling?
Well, my oldest, my 14-year-old, she liked this, so she'd rather sit at home and learn online. My other children, my other three, they rather be in school learning. So it's kind of hard for them to understand that this is learning for right now. So I try to keep them in contact with their teachers outside of learning, so they can feel like they're still connected with their teachers and their friends.
Yeah. Yep. So speaking of that, you have obviously, had a lot of different experiences with schools in DC and with your kids who have had various teachers throughout that time. Can you tell us a little bit about what your family engagement experience looked like both before the pandemic and then now what it looks like during the pandemic?
Okay, so before the pandemic out, my family engagement has been, it depends on the child and the school. With my son, he goes to West Educational Campus, that's a DC public school, and our family engagement has been really good. Even now that the pandemic is here and it's spreading, it brought us closer. Like for an example, I was trying to help him do something on a computer the night before, but I didn't know where to go at, and I was like, I shouldn't be texting her at 9 o'clock at night because she have things to do. So I just shot her a text. I was like, hey, I need help with trying to find a homework assignment. And she was like, oh, call me. I'm just sitting here binge watching a movie on Netflix. It's okay. And I'm like, oh, okay. Like, okay, you're up. So I felt that right there. I felt like, okay, I can really call on her after a certain time. Usually before this happened, I would usually wait to an appropriate time to ask her questions and stuff. So I was kind of scared sending that message. So when I got that reply back, I felt like at ease, like, okay, I can call her right now so she can help me figure out my son's assignment on CSO. With my other son, he goes to an all boys school. They're not family engagement just yet. And the beginning of the year, I asked for a home visit. A couple of teachers knew what a home visit was. The other ones didn't. I did one home visit, one of his teachers. The other two, they didn't want to do it, which was fine. Now that we're here and we are doing homework and classwork online and things that they don't know about my son that he displayed while he's over the computer, they don't know how to handle it. So now one of the teachers was like, Don, we should have just took that home visit to get to know who you was as a mom and get to know Elijah as a student. So it brought us closer. So we have our ups and downs, but it's going to be okay. Hopefully next year be a little different.
Yep.
So that's about it.
Yeah, and we know that that home visits specifically, for relationship building based on the parent-teacher home visit model, which is, what you have experienced and seen the power with, it can be such a great way to build relationships. And then obviously, in the midst of the pandemic, that relationship building is taking place in different ways.
Yes.
So right now, as you think about your family engagement experience right now, what's feeling most important to you? What's feeling most important to your kids as you're kind of moving forward through the end of the school year and as you're thinking about kind of what's happening over the summer and beyond?
Um, the most biggest thing that I want to make sure that my child is promoted to the next grade. Like I know that they're doing things different because of this, and we're at home. I really been like talking to the teachers, like asking, like, is it anything that I need to do as a parent to make sure that they go to the next grade? And they was like, just know they just have to participate online. My biggest concern was my son because he has an IEP, and I was afraid that he was going to fall behind because he get pull out time and he get one-on-one time. They really have proven me wrong because they have even done one-on-one time over the Zoom, and it just be him and his counselor together. That was one of my biggest fears. I kept telling myself I don't want my son to miss out on his one-on-one time, for social emotional because he's still growing in that area. And they was like, Mom, we got this. We will make sure he get it. If we have to be up together all day to make sure he get his one-on-one time, even though he's not in the building, it's fine. So she reached out to me over the phone and told me that don't worry about it, that he will still get his one-on-one time and he's going to be okay. So that's my biggest issue, and moving on to next year about how they're going to do summer school, because I don't want my kids to fall behind, but I have to play it by ear like everyone else.
Yeah. Yeah, well, and when I feel like we've heard stories of educators who are really sort of stepping into this and able to go above and beyond in many cases to be able to make sure that their students are getting what they need, like like your son's example, which I think is just such a powerful way to continue that family engagement connection. As you're thinking about, you mentioned the summer and sort of the boat that we're all in right now, where we're kind of waiting to see what happens, not knowing what's coming next. And as you think about that, like, are there bright spots that you're looking forward to as we go into the summer? And then what are some of the major concerns as you think about the fall and what that means for, your kids going back to school and how that impacts you as a parent?
I'm going to be honest and be real. Them adjusting to being back in school full time with just their teachers, they used to send their teachers, but then they have to get used to, oh, mom have to help me, my dad have to help me, but I still see my teachers over the computer. So that's my biggest. I'm trying to talk to my kids about that right now. I'm like, no, we're not going to be doing this forever. We might be doing this for a little bit, but eventually you have to go back into the classroom and you still have to learn how to talk and do things the same way you've been doing, because at home you're a little bit different. You having fun, you being loud. So we talk about that all the time. But I think it's going to be okay. We're all going to get through this together.
Yep.
I keep saying that so I can be like, okay, we're going to get through this together, but we're going to get through this together, and our children's going to be just fine.
Yep, totally. I mean, and the important part of all that, right, is, the relationships that exist between you and your teachers and your students and all of us collectively as we sort of come together around this. Totally agree. One last question for you in this portion, and then we'll get a chance to talk with you a little bit later too. If you had any advice that you could give to people in schools or in policymakers who are thinking about reopening schools, what would be like the one piece of advice you would give from a parent perspective that you think is really important for folks to keep in mind?
From a parent, I would say this. I just make sure that everything is in place. Make sure they went over, like children with IEPs. Make sure they understand that this is what's happening. Because my son have an IEP, so I'm really advocating for the children with IEP because I don't want them to be left behind. And just make sure that everyone have a positive mindset, open heart, be genuine, authentic. And I believe with all that, then it could come together. Just don't leave. Make sure all the kids across the area have the same when they come back to school. Nothing different.
Yeah, awesome. Thank you so much, Andrea. We could talk to you all day about your perspective. As a parent, as you said, you're going to keep it real, which I think is so important for these kinds of conversations. And we're excited that you'll be sticking around for our panel discussion later. So we will see you soon.
Bye-bye.
Great. So y'all, in a few moments, we're going to hear from Patrick Corvington. Patrick is the executive director of Connect Ed, which is a parent-facing navigator organization in DC. For now, before we get to Patrick, we're going to ask you to take the poll that just popped up on the screen. So we're going to ask you, how are you feeling today? So go ahead and select in your poll how you're feeling, and then we'll transition to Patrick here in about 60 seconds. All right, so you all should be able to see the results of the poll on your screen right now. And what's standing out to me here, right, is there's a combination of folks feeling hopeful and grateful, and then some anxious and stressed and exhausted. And I think, and some other thoughts and feelings too, I think we can all relate to. I know for me, I feel sort of a mix of those emotions at different times. One moment I might feel hopeful, another moment I might feel anxious, and sometimes they all fit together. So it's interesting to see that coming from across the country too. All right, so thanks so much for responding. Don't forget to pose any questions that you have for our speakers using the Q&A box. And again, any other comments that you have can be shared and directed to the chat box. So now, as I said, we're going to move to Patrick Corvington. We're delighted to have him with us here today, the Executive Director of ConnectEd. And his team recently heard from more than 500 parents across DC who they work with directly to better understand their needs as the pandemic struck. So Patrick, tell us what's top of mind for the families in your network based on what you've heard.
Well, first, Justin, thanks. It's great to be here. I'm looking through the chat and I'm seeing a bunch of old friends, and that's always wonderful to see. So as you said, ConnectEd is a parent-facing organization. We support families in a variety of ways, most notably through school choosing, access to summer programs, and attendance in the fall. You're going to see me do this a lot, just so you know. That's about slides. It's not me saying I'm number one or looking for inspiration from above. We decided, based on our work and the fact that we work with about 2,500 parents, and what we're hearing from parents as we were talking to them through our school choosing process, that they were getting anxious. This is really pressing on their minds. We decided to survey parents. We surveyed about 2,200. 80% of those were in wards 7 and 8, which are the lowest income wards in DC. We've got about 491 responses and 14 parent interviews. So we feel like we got a pretty robust sample. And while we covered a lot of things in the survey, what I want to focus on today are what we heard in terms of distance learning, day-to-day life, needs, anxieties, and special education. So first thing in terms of data, most of the families we surveyed had 1 to 2 kids, some had 3 to 4. And most families had kids in elementary school and some in high school and middle school. But because there are multiple kids, these don't add up to 100. But the bulk were in elementary school. So the first question we wanted to get at is distance learning. So how comfortable do people feel with distance learning? Now, a note here. We put this survey out in the early days of distance learning, like we'd been in there for about 1 or 2 weeks. So I think that these numbers don't necessarily reflect what's going on now. But what we see is about 85% of families felt comfortable, somewhat or very comfortable with distance learning. But like I said, that might change as time goes by. Great. So while the numbers reflect something, I think what we learned in our parent interviews and some of the other questions is that it's more complicated than that. It's not just about the distance learning, not just about the experience of learning, but rather what's happening in the home. And I think what we need to think about overall is that everything that's happened has been distilled into the house, right? So we know that in education, all of us know this, we've been doing this for a long time, but you have to deal with home environment, with the classroom, with out of school time, with other agencies, public health, public housing, all of that. Well, all of that has come together in one place, which is in the home. And that creates a lot of stress and anxiety. So for starters, we've asked parents to go from being their child's first teacher to becoming their educator. And that's created a lot of feelings of stress and anxiety. I mean, a lot of parents talk about not knowing how to be a teacher, not being able to help their kids. And what we're learning, and we heard this earlier from Andrea, is that when you have multiple kids, each child is having a different distance learning experience. Some are very intense, some are lighter. Sometimes there's more contact with the teacher. The point being that because every child is having a different experience, it creates a certain amount of chaos in the home. And parents are talking about kids doing different things and how hard that is to manage. And then finally, access to technology. Now, of course, the digital divide has become a chasm. We know this is real, it's profound. But in this case, we wanted to know about the tools, laptops, tablets, etc. And what we found is that parents were really struggling to shift kids around from laptop to tablet, in some cases to phones. And the latter creates a real problem in the sense that we know that kids can't really learn on phones, right? It's really hard to learn on a phone. So that's suboptimal in terms of kids getting ahead. But more than that, what parents talked about is that they need their phones to access resources, to have meaningful connections with friends and family. And for those who are working, to simply do their work, right? So the absence of, rather the confusion around who gets to use what tool when creates a certain amount of challenges and chaos at home. Okay, so as part of this, we wanted to ask some basic questions, right? So what do people need? That was really part of how we improve our practice, how we can support families better. And of course, given that folks are in the home environment, and remember, kids can't go outside, tight environments sometimes, a lot of pressure, the pressures of poverty and stress and all of that, that there's this real struggle to find activities for children. So how can we find things to do? And there are lots of great organizations out there sort of helping provide support to families. Ed Navigator sends out information. We send out information to families about how to support them. The other that we found interesting was that food scored lower on the survey, and we think that's not reflective of what's really happening. We think that's reflective of the fact that the survey was done early, like 4 or 5 weeks ago, that if we made that poll now, that number would go much higher. In fact, that's what we're hearing from a lot of our partners, capital area food banks, shelters, et cetera. So while it appears not terribly high here, I mean, it's still 56%, 57%, I think it's much higher now. I think we're easily in the 70s. And then finally, what I want us to pay attention to, and this will be a theme that we push throughout the presentation, is mental health. That this notion of mental health and support and stress that's happening in the homes right now is so significant that we keep hearing about it and we have to attend to it. So, when we did this 5 weeks ago, 1 out of 4 parents wanted mental health support for themselves, and 1 out of 5 for their kids. 1 out of 4 and 1 out of 5. I mean, that's a quarter, 25% and 20%. Those are big numbers as it is, right? And it really speaks to the pressure people are feeling. Now, what we also know, that in the communities we work in, mental health therapy has a certain amount of stigma, right? So we decided just on Monday, a couple days ago, to issue a poll, a 2-question poll, one around mental health and therapy, and one question around emotional support, being able to talk to family, friends, being in a group, those kind of things. When we asked the question in that way, those numbers went up to 70% of families wanting mental health support or emotional support for themselves. So one of the things that's creating a lot of anxiety for parents, particularly in this, what I call the COVID context, is how they feel about their children's anxieties. And so half of parents feel that or experience their kids as being somewhat or very anxious, right? So you can imagine as parents, I mean, I'm a parent, when your child is anxious, you're anxious. I mean, there's that saying that you're only as well as your child who's not doing well. And so a lot of parents have told us, both through the survey and both through interviews, that this notion of having a child who's anxious, a child who's thinking about the future, who's asking what's going to happen this summer, or what are we going to do this summer? Are we going to go back to school next year? I mean, this kind of anxiety really creates a worry for parents. And what we heard, I think, that was most poignant is that parents feeling helpless in helping their kids. One quote that sticks with me is, "I'm their mom. I'm supposed to know how to make them feel better, but I can't. I don't know what to do." And we heard that over and over again, that in this context, parents are struggling not only with activities that we talked about, with how do I make my child feel better while also making myself feel better, right? So this makes for a very complicated environment in the home. Now, Andrea spoke to this earlier, and we really wanted to ask about this, about special education anxiety. And the reason we wanted to ask about this is that we know that special needs kids with IEPs, often find themselves with their IEPs not being met in general. I mean, this can be a fight and a point of tension for families and systems. Well, almost 3/4 of special education families feel their children's needs will not be adequately served. If you think about that, 3/4 of families feeling like my child's not going to get ahead, my child's going to be left behind, my child's not going to succeed. And so on top of that, I mean, there's a reason why we have reading specialists, special education specialists, behavioral specialists, right? Because they're trained professionals, right? Families, parents, feel really de-skilled in working with their kids in that environment, right? Particularly when they're also managing other kids. So there is this sense of, I don't know how to be a special education teacher. I don't know how to teach reading. So I don't know what to do. And since I can't do it and I don't feel like they're going to get those services, I'm terrified they're going to fall further and further behind. Now, there's also, and we heard this a lot, that parents saying, things are hard all around. We get that. But we have a special needs child, and it's that much harder. And I don't know a lot of other people who are facing this, and therefore I feel isolated, and I feel a sense of anxiety. And I think we're going to see this get worse over time as we approach summer, as we think about the different pressures in terms of resource constraints and all those things, and just time in the house together, right? That those pressures are really going to go up and create a certain amount of growing anxiety. So this is reflected in a couple of things. So if you remember the slide around needs I put up earlier, what we found again was that 1 out of 4 parents felt they needed mental health needs, 1 out of 5 for their kids. When we controlled for special education, families with special education kids with special needs, that number went to 70% and 40%. That families with children with special needs, 70% of them wanted mental health support, while 40% wanted them for their kids. So what does this mean finally? We used to talk about, or we all know, as I said earlier, I want to wrap up where I began, that across all sectors, people need to connect around education, right? Except that now, like I said, it's all boiled into one home altogether. So you can't separate education needs from other life needs. It's all happening at once. So we have to address other daily needs like foods, finances, housing, childcare in order to get anywhere. Mental health support for parents and their children should dominate this conversation. I think right now what we're seeing is there are few things that outpace the need for mental health and support services, especially for families with special education needs. And then finally, from a policy perspective, we know that policy responses have to be holistic, coordinated, flexible, calibrated. And the reason I say that is more than ever, the coordination has to occur among agencies, among support organizations, because the needs are so intense. They have to be flexible because parents can't access the services in the same way because of the stay-at-home orders and the distance learning environment. And finally, this notion of calibration. What I remind people is, it seems like we've been in this situation for so long. It's only been 4 months. This started in February, right? And so needs have changed so much over time that we have to be sure that we can continue to calibrate our responses because the needs will change. So as we think about moving forward, one of the things we know is that parent voices have to be in the conversation. We need to stay on top of what parent needs are. And so for us, it means continuing to poll families to try and stay ahead of knowing what they need so that we can calibrate those approaches. Keeping parent voices at the center to understand what their needs are overall. And then finally, we're really fortunate next to have Maya talk to us because she's been one of the leaders, both locally and nationally, around parent voices tied to policy. And that's, I think, a critical part of this is how do we engage parent voices in influencing policy. So I'm going to end there and we can move on.
Awesome. Thanks so much, Patrick. Wow, a lot of great information in there that I think really deeply resonates with what we've been hearing at Flamboyant, and I'm sure what other folks have been hearing across the country too. Your point that you can't separate educational needs from life needs, I think is one that is so important to keep in mind right now as we're considering what families all across the country are experiencing and what they need in addition to what we're hearing from families here in DC. I'm sure the audience has lots of really good questions for you that we'll get to when we get a chance to talk with you a little bit later during the panel discussion. So again, if you're in the audience, please do make sure that you're continuing to put those questions in there. So as Patrick said, we're going to shift now to talking and hearing from Maya Martin-Cadogan. Maya is the executive director of PAVE, a parent advocacy organization here in DC. But first, before we do that, we're going to ask you all to respond to this next prompt. So as you see on here, do you identify with any of these groups that are listed below? So you can choose more than one. So please go through and choose, and then we'll shift over to Maya in about 30 seconds here. All right, as you can see from our results here, a lot of us wear many different hats, parents and caregivers, educators, education advocates. We see that a lot of us throughout this time are experiencing the pandemic from a variety of different perspectives and with a variety of different identities that we all bring to the table. So, so thanks so much for sharing your results or for sharing your thoughts on that part. And we will now shift over into talking with Maya. Another quick reminder, if you do have questions, put them in the Q&A. One quick reminder on the chat box, we're seeing lots of really great things come through on the chat box. Please make sure to shift and make sure that you're sending your chats to all panelists and attendees. There's a little button at the bottom you can click, and that way we can make sure that all folks who are here can see. If it just says all panelists, it's only gonna come to us. So please make sure that you, when you're posting your great ideas or searching for different information, that you post to all panelists and attendees. So with that, I'm going to welcome, again, Maya Martin-Cadogan to our virtual stage, the Executive Director of PAVE. Her team recently heard from several hundred parents from across the city in DC as well to understand their needs. And Maya, your work with parents harkens really to grassroots organizing. So what are some of the most pressing themes that you all are hearing through the conversations that you're having?
Yeah, so one of the important things, thank you so much, Justin, that we experienced when we started in this crisis was that families wanted to make sure that we weren't forgetting about what all kids needed, whether or not that was now during the pandemic or as we started to think about returning to school. And there was a lot of uncertainty about what that return would look like. But what we wanted to make sure that we did, because we heard that from our families, is not centering just in the voices that we hear from all the time. So we have about 197 families at our leadership level who serve on our parent, leader, and education boards. They're meeting monthly in 2.5-hour meetings every month. They are working to draft statements, identify their issues, but they really wanted to make sure we were centered in what a number of families were saying across the city, which is why we did this survey in order to inform the work that they wound up putting together, that you can see on our website at www.dcpave.org/DC Schools Recovery. And on that website, what they put together was a statement of beliefs that's really grounded in what we heard here from parents. And so what we wanted to understand was threefold. First, we wanted to understand the impact that this was having on families, kids, and communities, that we could get the supports to families that they needed. To date, we've spent about $35,000 between mental health supports. We've provided group counseling for our families. We're now working on individual counseling, to grocery support. We send Instacart to families across the city so they can pick the groceries and food support needs that they have. We do technology support. So we've sent Chromebooks, helps families with internet access, as well as our work around making sure that families have the resources they need. We also have sent school supplies, because we've heard from a lot of families that sometimes the packets include you need to have glue and paper and rulers and protractors and all of these things that we assume families have in their households, but they don't. So we've sent about 300 families those school supply kits as well. And so this survey really helped to inform what were those things that families felt like they needed. Total, we heard many of the same things that Patrick heard from ConnectEd, but we heard about 330 parents across the city. That was every ward, but highest percentages in wards 1, 4, 5, 6, and 8. If you look at the city, that's where most public school students live. So we were proud that it was representative of the schools, where the schools are and where our kids are. 20% of the families speak another language at home. We did do a survey in Spanish as well, the same survey, and 25 families responded and took the survey in Spanish. We had a number of different races and ethnicities. About 60% were Black, which tracks with the number of students in our public schools. 18% were white and 11% were Hispanic and Latino, so a little underrepresented on Hispanic Latino. We had families with children in multiple types of schools. Our traditional public school system, which is DCPS, public charter, and private. A third of the families had IEPs, and almost half of the families received services like SNAP, TANF, Medicaid. And families were like every family in America, all sizes. So children all grade levels from infants to college. And what we wanted to know when we surveyed folks was, where are you getting your information, especially because this was a crisis, and we wanted to understand what kind of sources are parents learning about what's going on, and what sources do they trust. And then we wanted to understand, what were their challenges, what were they experiencing, how was this impacting them, and then finally, how was that impact looking amongst a number of different metrics that we had heard from our families. One is schools and learning, so that's distance learning, that's academics. Another was healthcare, because the physical safety was a big concern of many of our families, and many of our families are essential workers who are out on the front lines. Childcare, access to food and groceries, and access to resources, including income, housing, and utilities. And what we heard from them in terms of the communication was that there were three places where they were getting most of their information. One was from our city itself, our mayor's coronavirus website. Over half of the families were using that to get updates. Another was their children's school. And the third was Facebook. I think, in this new age, we often underestimate the power of social media, but that was a huge component of where families were getting their information. You also saw a big number in terms of texts and calls from friends and family, but what we really saw was that there were three big places: the mayor's office themselves, their children's school, and Facebook in terms of social media. And in terms of the biggest challenge, it matched what Patrick found. It was really around managing the homeschooling of their children. And that was 59% of families. I think a lot of families were also unsure about how their family's health would be affected. That was a little over half. And a lot of families at that time were also really concerned about how their own job or work would be affected. Similar to Patrick, we did this in the first few weeks after the pandemic started. And so I think this might shift and change as people and families are thinking about the longer term impacts and effects. But I think in terms of what we saw immediately was that homeschooling was number one, and then it was around their health and their job and work. And then we wanted to splice that data by how did that look differently across the wards from where we heard from families. I think one of the things that's really interesting is that if you look at Ward 1, where you have a high percentage of Latino families and a high percentage of families that are immigrant families, the number of families that were concerned about not being sure how their job or work would be impacted was much higher than in other wards. And I think that was often because what we were hearing, especially from our undocumented families, was that many of them were not able to access the benefits of the city, right? So they weren't on SNAP, they didn't have TANF, they weren't able to access unemployment. There were some small grant programs that our mayor's office and our council put together, but that was really uncertain for many of our Latinx and immigrant families. And so you saw that being a big concern. When you move to homeschooling of children, what's interesting is that number declines as you go east of the river. So when you're looking at east of the Anacostia River in DC, like every city in America, is often a dividing line. It's socioeconomically a dividing line. It is geographically a dividing line. And many of our cities have this. We have rivers or highways that separate many communities of color and many poor communities from the rest of the city. We have that here in DC. And that's the Anacostia River. But for those families, it was actually a little statistically significant that it was lower in terms of homeschooling. But what you saw were increases in other areas. So you look at 7 and 8, 7 in particular, more folks felt insecure in their housing. 7 and 8, 7 more folks felt insecure about their health. And you look at food, 7 and 8 are feeling more insecure about their access to food and resources. And then technology access east of the river is really poor in the city. And so it's one thing to be able to say, I can get my child on Zoom. It's another thing for the Zoom to be reliable. And so a lot of our families had real access to technology issues, especially around internet, because we also have some connectivity issues east of the river. And so you saw that starkly for our 7 and 8 families. In terms of the services in the city, our families, as you can see on this survey, received many, had many of the same concerns, but there were some things that were different for families that were receiving vouchers, TANF, and SNAP. More families were concerned at that rate about their health. More families were concerned at that rate about their job and having enough food and having access to technology and internet. And that's really important for us to be able to splice, because oftentimes we aggregate this data data and talk about all families' concerns as the same. And yet when you think about the different dynamics that families are working under, what we found is that families who are receiving services, this has had a disproportionate impact on things that are just about their general security as a family, and not just about the homeschooling. That's still important and still a major concern, but there are other issues they are experiencing at a much higher rate, which we also know leads to other concerns like mental health, and even long-term physical health, because the mental health implications and the stress have implications on our physical health. And in terms of the top challenges for families who are Spanish speakers from our Spanish survey, we saw some of those same pieces. So when you look at these rates in terms of the 25 families that did respond, 75% of them are worried about their jobs. We heard that from many of our Latinx families, and we immediately started trying to help them be able to access grant funds in the city. We were sending them groceries immediately. But they were often in jobs that were, hourly wages, where they didn't receive the same benefits that many of the rest of us received, and they didn't have access to the benefits and services that our city provides for low-income families. And so they were especially feeling the squeeze. When you look at these numbers, it's just dramatic. And so then the question becomes, as we look at each of these individual impacts, what were we hearing from families? Because we also in our survey wanted to really provide a space for families to give their qualitative information about what they were experiencing. We heard that resoundingly from families. Don't just make this a survey that asks questions that you guys can aggregate. Let us tell our stories. And so now we're going to tell the stories that we heard from our families. So in terms of the impact on schools and learning, we did see that 44% of our families were dealing with managing school at home as the most challenging issue. And what we heard in their responses was that they were getting varied levels of support from teachers and schools, and varied levels of communication as well. It was hard for the parents to know about how to guide and teach. You were asking parents, as we know, in the middle of a pandemic to become teachers, which is a job that requires a lot of professional development and support, and they were really worried about their kids falling behind. And many of our families have multiple kids in multiple grade levels, so they're managing different platforms. We also have a system of choice in DC where 60% even of our traditional public school system students are actually making decisions of choice. They're not going to their neighborhood school, and the other 50% of our total students are in charters, right? So you're talking about families that have multiple kids inside of the same household in different school districts. And so they're managing different lesson plans, different schedules, different grading policies, different platforms. This caused a lot of consternation for families as they were trying to figure out how to both work from home and support learning and become teachers. 22% also listed tech and internet as most challenging. For internet, families often talked about that not being reliable and being slow. We have serious connectivity issues east of the river. I lived east of the river for 5 years and paid a lot of money for internet, and it still was not great. And so internet was something that simply because of geography was often a barrier. And then devices were another issue, especially for families with multiple kids. That was something that our school system responded to and started to fill the gap around, but it's still something that there is still a lot of work to be done there. In terms of food and groceries, 20% of families labeled that as their most challenging issue. What we heard from families resoundingly, so in DC, I'm sure this is similar to other major cities, we have a real issue with grocery stores in communities of color and in low-income communities. Ward 7 has one grocery store, it's a Safeway. Ward 8 has one other. It is a giant, but that means that families really did not have access to food. And even when our families heard that between each other, when they were having conversations, they were surprised across wards, because families in wards 1 and 4 and 5 and 6, for instance, were talking about, yeah, they didn't have the toilet paper I wanted. And then families in 7 and 8 were actually saying, actually, they had no meat at the store because there's one grocery store in my ward and it has been cleaned out. And so there was really a lot of question about inequity, and we were seeing that in drastic terms from the pandemic. The other piece was that they were frustrated because they couldn't get what they needed, and they were worried because they were risking their health and safety while shopping around. Many of our families are single parents, so they're taking kids to the grocery store because they don't have a choice to leave little ones at home. That was serious concerns and consternation for many of our families that we heard in all of our surveys, but also in all of our meetings with families. There were many families who were trying to travel to Virginia or Maryland outside of our city in order to get groceries, but that was a concern because they were asking people to take them in cars and taking Ubers, and that's not safe during a pandemic as well. And then there was a loss of work, which meant that you couldn't buy the food that you needed, which was causing great stress. And we heard a lot of, unfortunately, shame from a lot of families that they couldn't provide for their families as they used to. That's a real stress on many, many families. And then many are just right now uncertain about what that's going to look like in the coming months. And so it means that they need to feel secure that we're going to continue to provide resources throughout the duration of the pandemic. On healthcare, 35% of the families listed that as the most challenging issue. And I think the biggest thing is, as we know in DC especially, many of our, not just our older family members, but our younger family members have adverse health experiences because of the injustice in our healthcare system. We have more kids with asthma, high rates of diabetes, heart disease, high blood pressure in our African American communities in particular. And so they were really fearful about what that was going to mean for their health. Interestingly, Children's Health here in DC is seeing a 3 times the rate number of kids being infected in DC. It's usually 1% across the world for coronavirus. It's 3% in DC. That doesn't seem giant, but it's huge. And what they're surmising is that it's because more kids have those underlying health conditions. That's a huge concern of our families for right now during the pandemic, but also in terms of thinking about what they wanted to see in the return to school, because we need to make sure that all of our kids are cared for. Fortunately, we've started to move towards telehealth appointments in the city, but at that time they were canceling appointments because they were worried about fear of infection, even for going in for other health concerns. And there's been just a negative impact on mental and emotional well-being. And that's a hard thing to address during the pandemic. Fortunately, many of the organizations have moved to doing telehealth as well, but that has to be with a trusted environment from someone who knows and understands the experience that families are dealing with and who can provide them the kind of services that they need. For childcare, that was a really big concern for many of our families that we imagine it's going to be an even bigger concern as we talk about the return to school, especially because many childcare centers cannot operate with the low numbers that are required by the CDC in terms of child to teacher ratios during the pandemic, which are even lower than what they usually are during the rest of the year. But they were now having to work from home and take care of kids. They were trying to teach kids. Like, we had many meetings. We've actually done 27 Zoom meetings with our families during the pandemic, and their attendance rates have been incredibly high, but they're joining them in their cooking, they're cleaning, they're managing the household. So they're trying to do work while also taking care of kids. And it's really hard when you have younger children at home for the whole day. And families also need to themselves find balance and have time for themselves. And so what we saw a lot is that even for families who were already staying at home or now home due to loss of work, it was just really difficult to manage all these different components and make sure that they were getting the food and supplies that their kids needed during this time. In terms of the impact to resources, as you can see on the housing insecurity, there was a large percentage for which housing insecurity was not a concern for them. But for a large percentage, 17%, that was the most challenging piece that they're dealing with currently. And so oftentimes we talk about these numbers as, oh, well, it's not as big as the other number. But for the 17%, that concern is huge. And we shouldn't have any environment where 17% of families have to worry about where they're going to live, especially for a pandemic. And then for our families in terms of being unsure about their work, that was a huge percentage of families. Over a quarter of families, that was the most challenging concern that they had. And this was early in the pandemic. So most of the families we heard from at that stage were hourly workers, were families like bartenders, house cleaners, construction workers. I would imagine that as this has an impact on the economy and we do this again, this will start to expand out to even more and more workers inside of the field, just as organizations and businesses and restaurants start to have to make longer term decisions that will negatively and adversely impact families. In terms of the impact on our families on resources, 28% surveyed listed uncertainty about their job or work as the most challenging, as I shared, but there was a wide spectrum. And I think the most important thing is really to understand that for low-income families, the stress and anxiety about paying for rent is just huge, and it's affecting their mental health. This is why we've moved to individual counseling sessions for our families, because they both need times to come together and realize that their story is not their story alone, but other people are in this same struggle as they are, but they also need to be able to address their individual needs. And that makes it really hard when you're in the house with kids all day. And that was especially stark for families who responded to our Spanish survey. And we just want to also highlight that not everyone could get their supports that were offered, and that makes it really hard, and as does the fear and uncertainty. So just the key takeaways as we wrap up is just this is a disproportionate impact. Fear and stress are everywhere, and everyone is managing this, and they want to make sure that they remain healthy, that their kids remain healthy, and trying to manage childcare and school at home is just really a challenge, and will continue to be a challenge even as we move into the fall and move into some version of in-person learning and some version of continued distance learning.
Great. Thanks so much, Maya. Wow, lots of really, really great information in there, and so many things for us to consider, with the combination of teaching kids at home, having to worry about a job, work, childcare, mental health. That balance is hard for families right now. And some really great data about how immigrant and undocumented families are experiencing this as well, and all the important considerations we need to think about there. I saw some really great conversations going on in the chat related to that too. So Maya, Patrick, Andrea, I'd love to talk with you all together about some of the synergies in what you're hearing and what might be done to be able to solve for some of those things. So participants, before we dig into that conversation, we have another poll for you here. And this is the last one that we're going to ask you to do. So did any of the following themes surface in your community listening? So we've heard that, from the survey that you all did, that right about half of you all have done some community listening already. We'd love to hear, based on that you've done, or just based on your own knowledge and your own experiences, what kinds of things resonate based on what you've experienced here? So I'll ask you all to take this poll, and then we will transition into our panel conversation after that. All right, so a lot of the same things that we've heard, right, are resonating with what you all have heard from communities too. The intersection between basic needs, inequitable access to resources, and the importance of mental health and other pieces too. So, so thank you all for sharing on that based on what you're hearing from around the country. So, so at this point, I'd like to transition to our panel conversation, and I'm just want to open up with a few quick reflections based on what we've been hearing at Flamboyant, and then bring forth some of the synergies that we've seen here. So, as we move in here, some of the things that we've been hearing based on conversations we've been having with families and educators in DC and beyond DC, there've been some bright spots to highlight. So we've heard many examples and stories of the innovative ways that teachers have been engaging students. And Andrea was sharing with us a bit about her son and his experience with his IEP, and we've heard so many great stories of educators really stepping up to the plate to be able to engage students in creative ways. We've also heard that in some cases the current situation has served to strengthen effective communication between families and teachers. Given the state that everyone's in, sometimes those conversations have been strengthened. And we've also heard that families have been learning more about how their own students learn. So, families are playing those roles. They're their child's first teacher, as Patrick shared, and now they're sort of being taking on a little bit of a different role. But we've seen that that they're learning more about their students and how they learn too, which is really great. Obviously, we've heard a number of challenges too that are consistent with what others have shared. We've heard challenges with the type of communication and engagement coming from schools and districts, families expressing a desire for a tailored approach to account for the reality of their individual situations, the inequities of distance learning with devices, connectivity, navigating multiple children needing access to those devices at the same time, challenges with students with special needs to access the supports that they need, speech therapists, resource teachers, highly specialized and difficult to replicate at home, so being able to get access to those services. And then the social emotional supports for both students and families. Families are worried about the mental health of their children. They have anxiety about sending them back to school, and they're worried about the lack of socialization they've been having. And then finally, the academic piece. Teachers are concerned about how they'll be able to effectively understand where students are academically and what they need when they come back. And families need support to be able to share that information with teachers based on all the work that they've done with their children. And they need more support for doing that learning at home in general. So given all of that, I'm excited that we have this group today to help us learn more about what they're seeing and hearing, and to engage with some of the questions that you all have submitted as you've been listening and reflecting on your own context throughout today's webinar. So I'm going to start with a kickoff question for everyone. And so our first question for all of you, can we talk about the toll that this pandemic is taking on students and families mentally and emotionally? So what's that looking like? What support must be in place for kids going back to school? So I'm going to start with Andrea. We'll start with you first.
I can honestly say it has taken a toll on my family, where we're doing family therapy, like right now, together and separately. I know for me, I've been a little bit emotional because I have 3 children who require different things at different times. So I have a child who needs more attention than one child. Then I have, for an example, my daughter. In the middle of this pandemic breaking out, my daughter was in school, and literally before they closed school, I took her out of one school and put her in another school. And she's been in that school one day before they closed school. So she don't know none of her teachers. She don't know her schedule. So can you imagine how I was feeling when they closed school and they was talking about distant learning? So I'm like, what's my daughter teachers? What is she gonna do? I need classwork. Like she missed the first 2 weeks of distant learning because we didn't have a laptop. We didn't have her class schedule. I think in Aspen, they still had her under charter school instead of DC school, so we had to wait a couple of days for that. So that was my biggest concern. I wasn't worried about my other 2 children because they were okay, but I was really worried about her because she just transferred like a day before they closed school, and she was not in school. She didn't even get a chance to go to school, so she's literally been out since February. So it's hard, and it was hard on her. So we're talking about that. So I think we're going back into school for next year. They need to have a lot of things set up, like counselors, so kids can express, because they want to be frustrated because they have to get back on track. They're used to being home with their mother and father and seeing their teachers over the computer. So they have to get back on track on doing things. It's going to be a lot of separation anxiety, because I know I am. I'm going to be going crazy like, oh my God, is my son okay? Is my daughter okay in school? Does she not know what class to go to? So they need to have a lot of that on hand, counseling and stuff like that for the children to come back to school.
Yeah, thanks, Andrea, and thanks so much for your vulnerability and sharing your personal experience there. Patrick, what about you? What do you think?
Thanks for the question, and I appreciate Andrea's response, because it's so much of what we're seeing as well. That first, there's this notion of disorganized learning, right? Like I said earlier, that students are having such different experiences in the same household, that kind of stress, I think, is going to continue. I think that there is so much stress about the future. I mean, I expect that in the coming months that we're going to have essentially a kind of post-traumatic stress disorder based on what folks are going through now. I mean, Andrea talked about the stress she's experiencing, and we hear that with all parents, particularly with special needs parents. I mean, I have a special needs child, and I know what it's like in the home to try and manage all of that. I think that one of the ways that students are going to be most impacted is the lack of social connections right now. That the lack of meaningful connections between their friends, between themselves, I think can be really isolating for students. And learning how to reconnect with other students is going to be, I think, hard. And as Andrea said, there's going to be a lot of separation anxiety. Even though this is becoming a pressure cooker in houses, in homes, you know, once it's time to go back to school, if we go back to school in time in the fall, you're going to have kids who have not sat in a classroom in 9 months. And that has some real implications for what that means about learning, all those kinds of things. And then finally, I think that in terms of what's happening right now, you know, I think we've allowed schools to decide so much that schools that weren't doing parent engagement work well before are doing it worse now. Schools that were doing it well before are doing it better now in some cases, right? Because they've bought into the ethos of it, of doing parent engagement. So they're making that extra effort. And we're seeing that in parent households all the time. And finally, I think that there is so much stress right now with school about to end around summer. You know, what's going to happen this summer? Parents are stressed about it. Parents are thinking, you know, how do I mean, right now, at least I've got some school involved, but what do I do this summer? You know, there's been a lot of attempts at doing some online or virtual summer pieces, but, you know, east of the river, Department of Parks and Rec in DC serves 16,000 kids, 16,000 kids who might not get served directly. I think that these are going to be some real challenges. And so anyway, to wrap up on this, I think that the absence of social connections for kids is going to be really traumatic. Going back to school will be equally traumatic for parents and their kids. And I worry that we're going to treat this as normal, that in January, we're going to act as if these kids have had a normal educational experience when clearly they have not. And so I think we need to really be careful on the policy side about how we work with kids who have not had the kind of education they deserve over the past, you know, 8 months or so.
Great, thanks, Patrick. And we'll shift over to you, Maya, for your thoughts.
Yeah, I mean, I think, you know, I echo everything that Patrick and Andrea shared. There's a really good question in the chat from Tatiana about communities advocating for themselves, because I actually think, you know, in these times of challenge, I think what was beautiful about what Andrea talked about was, you know, being hopeful and feeling like we can get through this together. And I think communities are really starting to understand that you can turn the frustration and the anger that you've had about the inequity and the way that the system has worked for so long and not worked for our families into action. And so I think that's the most important thing, that, you know, is that people feel inspired even by each other and by what's possible. Recently in DC, you know, we had our budget come out, not recently, it was literally this week. So our budget came out from the mayor on Monday. And while every other state and city is slashing education budgets, DC saw a 3% increase on our per pupil funding, which is huge. We're one of the only states and cities that I know that's doing that level of investment. And that's because of community action, right? So our families had 78 parent leaders join a town hall with the deputy mayor for education 2 weeks ago. That was insane, right? We wouldn't even expect that 78 parents would join a town hall with the deputy mayor for education at 1 p.m. on a Tuesday or Thursday on a regular day, let alone during a pandemic. But they cared, and they were asking him hard questions about what this was going to mean for kids and about how they were going to continue to invest in children. And so I think one of the things that, you know, this kind of crisis is encouraging for all of us is to make sure that we're not stopping to beat the drum, that we're continuing to beat the drum, that we're not stopping, that we're really calling out the issues of inequity that are made more inequitable by the pandemic, that we're making sure that our city and our leaders are taking the feedback from families, that they're incorporating parent voices, that they're making sure to invest in our kids in the way that they're needed. And that if this should do anything, it should make us understand that power is not a zero-sum game, but that we can all have power inside of the system in order to make the change that we need to see for our communities and our schools.
Great, thank you. So I'm going to turn to a few more audience questions now, and we got a lot of really great questions in the Q&A. So just an unfortunate note for everyone that we won't be able to get to all of them, but I'm going to pick a few that I think are representative of some of the questions that are coming through. There's an interesting question about the role of families and family voice as part of the discussion for schools to reopen. And as we think about, the work here in DC and beyond DC, I'd be curious in getting your take first on this, Andrea, and then and maybe we'll have a minute for Patrick or Maya to throw their thoughts in here too. But Andrea, like as a parent, as someone who lives in DC, how would you as a family, or how would you want other families in addition to you to be a part of the voice and discussions for like how schools can reopen?
Can you repeat yourself again? I'm sorry.
Yeah, you bet. Like, how would you as a family or as a parent want to be involved and be a part of the voice for how schools should reopen? So how would you want to be involved in those kinds of discussions that are taking place across the city?
How would I want to be involved? First, they have to reach out. Okay, so they have to reach out to the parents, or the parents whose kids are not at school. I want them to reach out like by email, phone calls, a survey. That's it. That's about it.
Yep. Great. Maybe Maya, given your experience sort of in the advocacy world, I'm curious on your take on this about how you think that parents and families should be involved in the policy level decisions that are happening here.
Actually write the vision for what that looks like. So our parent leaders, part of what you'll see on that website is our parent leaders actually put together a 30-page, yes, 30 pages. They met 27 times to put that together, vision for what recovery would look like. And one of the things that was important for us as they wrote that vision is that generally grass tops leaders and people who have always had positions of privilege are always able to vision about what the world could look like in the future. And having grown up poor in DC, what we usually had to do was just figure out how to make it through the day. And so visioning wasn't a part of what we got to do, but we actually let our families do that. We said, close your eyes, imagine what school would look like when we return in the fall. How would you be spoken to? What kind of communication would you receive? Just like what Andrea was talking about. What would that trust look like between yourself and your school? What would that trust look like between you and the people in power in the system, the deputy mayor, the chancellor, the school leaders? How do you want to be spoken to? How do you want to be communicated with? What do you want the building to look like? Like when kids arrive at the building, what colors should they see? Who should greet them? And so part of what they started with was just visioning about what would return look like, so that then we could talk about what are those components of that return. And how do you do that in a way that centers itself in people and really centers itself in the idea of community. And so I think now is the perfect opportunity for people to get involved in that. And even if you're not being invited to the table, you make the table, and you make that table so amazing that they want to invite themselves. And that's what we've seen at PAVE. Our parents do that work themselves, and then systems leaders reach out to us and say, hey, can you help us? Can you help us do a focus group to follow up on that? Can we take your school's recovery plan and put that in action? We're like, go ahead, take it. But we have to take that power back as families, as communities, as people of color, as people who have often been denied so much of what we have deserved, and reinvent the wheel.
Yep, great, thanks, Maya. And so I'm gonna ask a different question. I'm gonna sort of shift gears given the time that we have. So, there's an interesting question about, knowing that the needs are really large right now when it comes to the effect that trauma has on students of color disproportionately. And also thinking about sort of in general, but then also in the COVID crisis, as we've shared in some of the data that we have here. Patrick, I'm interested in getting your take on this as, as an organization that works with families and helps them to navigate, school choice and that kind of thing, and how that sort of coincides with how we think about students experiencing trauma and the disproportionate effect with COVID. Could you see a space for organizations or people or ways for us to sort of work together to think about how to best support that with students in schools as we're going into the reopening phase?
Yeah, it's a great question. So I think so. One of the things I talked about is how services are disconnected, how they have been in the past, and right now that's become more acute. So certainly organizations connecting, partnering, staying in touch and thinking about what's around the corner for families is really critical. I do think a couple of things. One, students of color, students in low-income communities, kids were already in a place of trauma. I mean, there's a tremendous amount of research on this. We know this. It's gotten worse, right? So whatever we have done in the past, we have to amplify. It is difficult to do in this distance approach. And so I think we're still trying to find creative ways to deal with that. So virtual support groups, virtual therapy, all those kind of things, which are great. My concern is, how do you scale that, right? I mean, we're going to do some parent circles where we're going to serve groups of 20 parents at a time. We'll probably do 4 or 5 parent circles. That's 80, 100 parents. That's not anywhere near what we need to reach. So I think finding a way to embed that into all of the school work, I think, would be really critical. And it's also tied to the previous question, actually. So I think that on this reopening question, we've been a little too broad. We're talking about reopening for the city rather than reopening by community and by school. Because each one is going to be different. Each one's going to have different experience. So I think about the homeless community, homeless kids, which we work with closely. Their mental health needs, their reopening needs are going to be very different than other kids, right? So parsing this out to different communities, different kids is going to be really important. And I think we're still figuring out how we provide mental health services in a way that is at scale. And I mean, that's really a thing. I mean, we talk about 16,000 kids for the DPR. We talk about 30,000 kids east of the river. You know, that's going to be a hard thing to do.
Yep. Great. Thanks, Patrick. I'm going to ask one more question for Andrea, and then I'm going to wrap up with a question for everyone. So Andrea, I thought this was an interesting question that came from one of our attendees. What's one thing that you would want to know from your children's schools, knowing your kids go to different schools, that will make you feel comfortable about returning your children to in-person school days? What's one thing that you'd want to make sure is in place?
This is a really good question, because me and my friends was just talking about this the other day. And one will be, I will have to say the building is clean before they let the children come back. How are they? We haven't heard that yet. How are they going to make sure the children are safe when they return? And I know you just said one, but I have to throw this one in. I just want to make sure that my child gets the same services that every other child gets before I'm comfortable to return my kids back to school.
Yep. Thank you. All right. One final question for all of you. And we're going to start with Maya on this one. So when all's said and done, when all of this is hopefully behind us at some point, what do you want to be true for families, for educators, and for students? And we'll start with Maya.
Yeah, I want it to be true that we are being equitable. And that doesn't mean that we're being equal as a system. That actually means that we are giving every child and every family what it is that they need to be successful. And that means that in many ways we are paying attention to the ways in which we've underinvested in communities and families and schools, and writing a lot of those pieces for our future, when our futures are kids, right? So we have to invest in them. They are the center. And so I hope that from this, what we will learn is that if you put people at the center of everything you do, everything will grow and be better and stronger. And that is how we have to operate as an entire city, as an entire ecosystem, and ideally as an entire country. We got some work to do in that regard. But I really feel confident that DC can get there in my city. And so how do we do that in a way that really makes sure that we're taking care of all of our children who are our future?
Yep. Thanks, Maya. Patrick, over to you. Same question.
Let me start by saying that, I spent a lot of time working on Katrina, and what we know for sure is that low-income communities, communities of color get left behind whenever there is some kind of natural disaster, which I think of this pandemic as that, right? And so what I hope is true, what I would like to be true, is that when we turn to some sense of normalcy, that the communities we work in, the communities we care about, have risen to a level of equity with other communities, that we have ensured that services have been provided adequately. And to me, it's particularly important particularly important that when we talk about low-income communities, that we not group them into one community. So when we think about homeless kids in particular, I'm very concerned about what's going to happen with homeless kids in foster care youth. And for me, it would be wonderful if it were true that all kids are being served in the way that they deserve, and all kids are being treated equally in the way that they deserve, and that we learn from this how to get better about coordinating, about serving, and about ensuring that not just in the city, but nationally, that we're serving kids in a way that they deserve and have a right to be served.
Great. Thanks, Patrick. And lastly, over to you, Andrea. We're going to give you the last word on this. What would you want to be true for families, for educators, and for students at the end of all of this?
Can you say that again? I'm sorry. I'm looking at you, but I'm looking out the corner eye at my son right now because he's doing something that he's not supposed to be doing.
Hey, no worries. That's the reality for all of us right now, with my own kids too. So what would you want to be true after all of this is behind us and hopefully, everything is back to some new sense of normal? What would you want to be true for families, for educators, and for students in that new reality?
The thing that we've been talking about this whole presentation, all our children get the same thing across the board. That's really sticking to me because I have a child with the IEP. So I just want to make sure not just my child, my friend kids, my best friend children, that all kids get the same thing, access to everything all the way across the board.
Yep. Great. Thank you, Andrea. Thank you, Patrick. Thank you, Maya. Thanks so much for your time today and for your thoughts. I'll give you a virtual round of applause because it was incredible to hear your experiences. So with that, we're going to get ready to wrap up here. So as you've heard from our guests and see from the chat and the polls, there are a lot of different challenges to navigate to support students and families during this time. And at the same time, I'm left with such a feeling of hope because these challenges aren't insurmountable. And what's really real is that at the end of the day, we all need the same things to get by. And it's critical that we have those things because strong foundations at home and strong foundations at school are essential to us working together to support students. It's also a reality that we have to keep listening now and far beyond the pandemic, and hopefully this will continue, into the future, ad infinitum, inviting family voice to the table in real and meaningful ways. So to wrap up, I want to invite you all to share what you're learning with us because the more we know, the better we're equipped to serve. So if your organization has done any listening to the communities you serve, if you've created a report, a memo, an email update, anything that you think would be useful, please send it to us. Send it to communications@flamboyantfoundation.org. We'd love to make sure we're all able to access those learnings from one another. So look out for follow-up from us. We never know what innovations can be sparked by access to what we're hearing. So no matter where we live, so please share those things with us. We'd love to be able to hear what you're hearing. In addition, please follow us on social media. You can find us on Twitter @FlamboyantFDN for Foundation. And some exciting news to share. We just launched a temporary news column called Shifting Perspectives, where we're elevating voices from the field, from students and families to teachers and leaders. So check that out at flamboyantfoundation.org/news. Thanks again so much for joining. A huge thanks to Andrea Henson, to Maya Martin-Cadogan, to Patrick Corvington for joining us today. And that includes our convening. Have a great day, everyone, and we'll talk to you soon.